From suddenly feeling like you're tired all the time, to feeling like you have to pee every second, to craving some of the foods you've never craved before, the first trimester could be a whirlwind. Today, I'm going to walk you through the first 12 weeks, how to prepare your body during this time, how to better cope, and how to take care of yourself for you and your growing baby with confidence. Let's get into it. First, my name is Ade Tutu, and I am a board-certified women's health nurse practitioner. I specialize in obstetrics, which is pregnancy, postpartum, which is after giving birth, and gynecology, which is all things women's health related outside of pregnancy. If that is of interest to you, go ahead and click that subscribe button. So let's talk about the first trimester. That is the first 12 weeks of pregnancy. That is exactly 3 months. Now, you might not look like it because you're not showing yet, but your body is actually working overtime. Right now, your body is trying to create the placenta. It's forming the organs for baby, and it is releasing hormones that are going to prepare you for a healthy pregnancy. So I always say, don't let the outside fool you right now during this time. Your body is laying the foundation for a fruitful pregnancy. And a lot of times that could be hard on the body. That's some of the reasons why these symptoms are so dire during the first trimester. Most women say that they have the worst pregnancy symptoms during their first trimester. Guilty. Now we're just going to talk about some of the developments of the baby, just so you can get an idea of how much is working. In the first few weeks of pregnancy, your baby is super tiny, but lots of things are developing right now. The first thing to develop is the heart. Okay. It develops into this S-shaped tube and it's able to start pumping blood and start beating as well. Then we have the development of your nervous system. So that's the brain, spinal cord, and nerves. These all start to form as well. This is why it's very important for you to take your folic acid even prior to getting pregnant, because it can help to prevent things such as neural tube defects. So that's spinal cord issues. Okay. You'll also start to see little buds that look like arms and legs. Eyes and ears will start to appear on the sides of the head, and then eventually they'll move into position. Even tiny tooth buds, the tongue, and taste buds start to grow. I know, amazing, right? And then also your baby now has a neck, eyelids, fingers, toes, and can even swallow. And yes, even the baby starts to move. Baby will start to move inside your tummy, but you will not be able to feel this yet. Usually, women are able to feel pregnancy movement between 16 and 24 weeks. 16 weeks if you've done this before, and then later if this is your first time. By the end of 12 weeks, your baby pump is starting to grow. It's just now above your pubic bone, but we still won't be able to see it yet. For girls, the ovarian follicles are forming. For boys, the prostate appears. With all of this happening, your baby is only the size of a plum. I'm going to show you. Only this size, and you're having all of these symptoms, the size of a plum. But your body is working overtime, and you may have a lot of symptoms during this time. So now we're going to talk about the most common symptoms that women have during the first trimester. Now, most women, the first sign of early pregnancy is when they miss their period. That a lot of times is when women decide to take a pregnancy test. Now, what if you have irregular periods? Well, this is why it's good to pair missed period with these symptoms that I'm going to talk about next. One of the biggest symptoms of early pregnancy is nausea and vomiting. So nausea and vomiting is one of the most common symptoms. And that's simply because of the shift that's happening right now. There's a lot of progesterone in the body to keep the pregnancy healthy. And then there's a release of HCG, human chorionic gonadotropin. This hormone is what is detected when you take a pregnancy test, and it is pretty high all the way to 10 weeks. It peaks at 10 weeks and then it starts to decrease. So to manage nausea and vomiting, your provider can do several things, right? So they can prescribe over-the-counter medications for you like vitamin B6 or even something as simple as ginger. Now, just to get a little bit more intense, they can prescribe medications for you like diclofenac, Zofran. Sometimes it's just a trial and error until you find what works for you. Some women are actually admitted in the hospital and they're given medications through the IV until they're able to cope. This condition is called hyperemesis gravidarum. Next are mood changes. Again, that's thanks to all this progesterone your body is getting. Progesterone is the hormone that gives us mood changes when we are not pregnant. So now you have a huge influx of it right now. So another common one is fatigue, feeling very tired. Now your body is doing a lot. It's doing something that it hasn't done before or hasn't done in a while. It's making it human. So it is bound to be tired. So try your best to sneak in your naps, sleep in, do all these extra things that can give you as much rest as you can. And then there's bloating and having sore breasts. And then there's frequent urination. So that's having to pee all the time. That's thanks again to the hormonal shift and to the extra increased blood flow to the pelvic region. But please stay hydrated. I know drinking more water can make you feel like you need to pee more, but you need all the water you can get because we want to prevent UTI and we want to keep you hydrated as well. Okay, so last symptom we're going to talk about is your appetite changes. Okay, so now you may be craving foods that you've never wanted before, and you may hate foods that you used to love all the time. That's completely normal. What's not normal, though, is craving non-food items like dirt or chalk or clay. This is known as something called pica. Now, pica is a craving of things that are not food. It can be caused by things such as iron deficiency anemia. If this happens, your provider will probably recommend iron supplements or prenatal vitamins specifically for whatever you're deficient in. This is why it's very important for you to go to your prenatal appointments because you can discuss with your doctor some of these symptoms and they can let you know whether something is normal or abnormal and then address it as quickly as they can. Which brings us to the next point, what to expect during your first prenatal visit. So this visit is more than just a routine check. It sets the tone for the rest of your pregnancy, and it is very important for you to go to your first prenatal visit. So at this appointment, your provider might confirm your pregnancy through blood tests, through urine, or through an ultrasound if you're far enough. Calculate your estimated due dates together. You'll review your personal family health and history, which is very, very important. And then most of all, your provider will do a physical examination, which will check for your blood pressure, your weight. You may need to do a cervical cancer screening, so you may need to do a pap smear if you haven't done it recently. And then your provider could check for infections such as group B strep and then treat appropriately. Your provider will also order labs that can check for things such as anemia, diabetes, hypertension, and etc. The earlier we know these conditions, the better we can manage them. So it's very important for you to get to your first prenatal care visit. I recommend having a pregnancy journal where you can jot down all your symptoms, things you're craving, things you're eating, questions you have for the doctor, and things that you just think about that you don't have an answer to for your prenatal appointments. So when you get to your prenatal appointment, you're able to review everything with your doctor and you quickly have answers. These can make these appointments go seamlessly and you can quickly get your questions answered. And I also know about pregnancy brain, so that's another reason why you should definitely be keeping a pregnancy journal. So your doctor may want to dive into things such as intimacy during pregnancy, traveling during pregnancy, what foods to eat, what foods to avoid, how much weight should you gain, what exercises are safe during this time. Also your mental health. Having a new addition into your family, you could be nervous, you could be anxious. So these are some of the things that you can discuss with your provider. Your provider can suggest programs that you can join where you can discuss some of the things that you're feeling with people who are going through the same things with you. These are some of the reasons why it's very important for you to go to all of your prenatal care visits. Research shows women who went to less than 5 prenatal care visits actually had complications and unfortunately even had losses. Every visit is very important. Also during this visit, if you are high risk, your doctor can do things such as referring you to high risk specialists specifically for whatever you're high risk in. So let's quickly talk about the nutrition during your first trimester. Now, this goes along the line of a lot of the foods that we should be eating when we are not pregnant, right? So that is your vegetables, your fruits, your lean proteins, your whole grains, and lots of water. And then do not forget, it's important for you to take your prenatal vitamins with folic acid. Just as important as what you should eat is also what you should limit or avoid altogether. So we're going to quickly touch on this as well. Make sure that you are avoiding raw or undercooked meats, unpasteurized dairy, meaning dairy that comes straight from the animal without getting heated, deli meats, and my caffeine ladies, high levels of caffeine. Just stick to 1 cup of coffee a day, but more than that is not recommended at all. I made a full video dissecting all the foods to avoid and eat during pregnancy. You can check that out next. Remember, with nutrition, it's not about perfection, okay? So do your best to eat the foods that will nourish you and your baby. Now, lastly, I've already touched on this, but let's touch on it some more, which is the importance of checking in with your mental health. Pregnancy is a highly emotional time, and it's really important for you to check in with yourself to understand how you're feeling and to connect with people who are able to help you. Make sure that you are checking in with your provider. Your provider can help you actually connect with pregnancy support groups or give you therapy or counseling referrals and or community resources. And most of all, remember, it's okay to feel a roller coaster of emotions. You're adjusting to a new chapter in your life. Now, if you found this video helpful, I do want you to share this with an expecting mama who it can also help as well. I want to do something fun in the comment sessions. If you have had any abnormal and weird cravings, share them below. I love hearing about my patients' pregnancy cravings. It's always interesting, the combination. So comment down below your pregnancy cravings. Again, if you found this video to be helpful, please don't forget to share, like, and subscribe. Thank you so very much for watching. Take care of yourself. I'll see you next time. Bye.